Welcome to The Explainer. I'm absolutely thrilled you're here today because we're looking at some truly fascinating, cutting-edge science. We're going to be exploring exactly how modern medicine and nutritional science are attacking one of the most pervasive health crises of our time, and that is fatty liver disease. Now, the best part about all this? We're going to look at this problem from three entirely unique, brilliantly distinct angles. But first, we really need to wrap our heads around the sheer scale of what we're dealing with here. Look at this number, 30%. A staggering 30%, which is about 1 in 3 adults globally, suffer from this condition. I mean, it's literally a massive, silent epidemic hiding right in plain sight. And the scariest part is it often develops without any outward symptoms at all until it's dangerously advanced. Okay. Let's dive into this. So the formal medical term for this condition is MASLD, or metabolic dysfunction-associated steatotic liver disease. Now, you might have previously heard it referred to as NAFLD, or non-alcoholic fatty liver disease. Basically, it's what happens when excess fat starts building up inside your actual liver cells. It's heavily tied to metabolic syndrome, visceral obesity, and type 2 diabetes. I want you to imagine your liver for a second as its massive, highly efficient metabolic factory. It processes your nutrients, it filters out toxins, it manages your energy. But under the immense stress of MASLD, this factory is just completely overworked. The inventory, which in this case is fat, is piling up on the factory floor, it's clogging all the machinery, and it's causing massive systemic issues. So how do we actually fix a broken, overworked factory? Well, what if I told you the answer might involve a combination of 3 wildly different things? Think about it. What do eating daily oranges, cutting your dietary carbs, and taking standard blood pressure medications actually have in common? On the surface, absolutely nothing. But as we'll see today, these represent 3 distinct scientific weapons that researchers are currently using to rescue our overworked liver factory. Here's our quick roadmap for today. 1. The silent liver epidemic. 2. A squeeze of citrus. 3. The low-carb solution. 4. 2 drugs, 1 cure. And 5. Your liver's future. Let's start right off with Section 1, the silent liver epidemic, and truly understanding the global stakes here. Look, we aren't just talking about some abstract science happening in a lab somewhere. We are talking about severe, life-altering stakes. Because MSLD affects 1 in 3 adults and is just so tightly linked to obesity and diabetes, it's become one of the leading causes of liver-related morbidity and liver transplants worldwide. But honestly, perhaps the most alarming detail of the whole thing is that a fatty liver drastically elevates your risk of fatal cardiovascular disease. These patients aren't just facing liver failure, they are facing an incredibly high risk of dying from heart and blood vessel complications. It's a huge deal. Moving right along to Section 2, a squeeze of citrus, the subtle tweak. So, researchers recently ran this randomized clinical trial with 60 patients suffering from MASLD. The setup was actually incredibly straightforward. The experimental group consumed 400 grams of Novalina oranges every single day for 4 weeks. Meanwhile, the control group abstained from oranges entirely. Think of this dietary approach kind of like giving the workers in our metabolic factory a new, subtle piece of protective gear. The researchers really just wanted to see if the natural polyphenols in the oranges could protect the liver and actually shift the patient's lipid profiles. Now, what's really interesting about this data is the fascinating co-directional shifts we're seeing in the blood work. In the group eating the oranges, researchers observed a directional decrease in total cholesterol and LDL, which is the bad cholesterol. Meanwhile, HDL, the good stuff, actually increased. And brilliantly, the ratio of AA to EPA decreased. Now that essentially points to a shift toward an anti-inflammatory state in the whole body. Every single arrow here is pointing in the exact right direction to help protect our factory. And this is absolutely crucial, the biggest takeaway comes straight from the researchers' own conclusion. They were very careful to note that these changes were modest and non-significant. It's so vital we don't jump to false conclusions here. Eating oranges didn't magically cure these patients in 4 weeks. Instead, the study offers what scientists call hypothesis-generating insights. It basically shows us that adding polyphenol-rich foods like oranges is a really positive, protective nudge for the liver. But it's just one piece of a much larger puzzle. Which brings us to Section 3, the low-carb solution, the lifestyle overhaul. Right, so if eating oranges is a subtle protective nudge, our next approach is a massive structural renovation of the factory itself. A fascinating study published in the journal Nutrition and Metabolism looked at a much more robust subtractive lifestyle change. They put 220 patients diagnosed with fatty liver on a strict low-carbohydrate diet, keeping them to under 130 grams of carbs per day. The timeline here is what really matters. By week 8, they were already seeing measurable improvements, but the diet was significantly more effective when patients stuck with it for 12 full weeks. That's really when peak effectiveness was achieved. And honestly, the physical results of this 12-week overhaul were pretty stunning. On average, patients experienced a 4.84 centimeter reduction in their abdominal circumference. They also lost an average of 4 kilograms of total body weight. That's a very real, tangible difference. But let's look under the hood at the internal physiological benefits, because that's where the magic happens. By cutting the incoming workload, specifically the carbohydrates, the burden on the liver factory dropped massively. Levels of GPT, which is a really key marker for liver inflammation, decreased significantly. Glucose metabolism improved. Diastolic blood pressure dropped. The underlying biological mechanism here is just brilliant. Reducing carbs leads to initial water loss, it inhibits the appetite, and it forces the body to literally destroy stored fat for fuel. All right, on to Section 4. 2 drugs, 1 cure. The medical intervention. So, we've added our oranges, and we've subtracted our carbs. But what happens when diet and lifestyle just aren't quite enough? To understand this next medical breakthrough, we actually have to travel to the University of Barcelona. There, researchers enlisted 2 very unlikely heroes, rats and, wait for it, zebrafish larvae. I know, it sounds a little funny, but zebrafish are actually incredible for this kind of research. Believe it or not, their metabolism and liver functions are surprisingly similar to our own. It allows scientists to run complex experiments much faster and more affordably. Historically, pharmaceutical companies try to invent that one powerful, high-dose magic bullet to fix a disease. But with MASLD, those experimental high-dose drugs frequently fail clinical trials because they end up being toxic to the patient. So researchers tried a totally new strategy, drug repurposing. They took 2 drugs already out there on the market, telmisartan, which is a standard blood pressure medication, and pemafibrate, a lipid-lowering drug. By combining them at very low doses, they found this incredible synergistic effect. It completely reversed the fat buildup caused by a high-fat diet in the animals. And because they only needed to use half doses, it was incredibly safe. Which, of course, begs the big question. How does this drug duo actually work to fix the factory machinery? Like, how on earth does a blood pressure medication actually rescue a fatty liver? And this right here brilliantly illustrates the sheer elegance of modern biology. The researchers discovered that the blood pressure drug telmisartan does something totally unexpected in the early stages of liver disease. It restores normal levels of a very specific protein called PCK1 in the liver. Think of this PCK1 protein as a manager on the factory floor. It literally diverts the factory's workflow away from making fats and redirects it toward making glucose. Now, you might be thinking, wait a second, won't extra glucose just cause diabetes? Amazingly, no. The researchers found that the glucose didn't accumulate in the blood. The fat buildup was safely reversed, the machinery was completely upgraded, and the overall cardiovascular risk was lowered all at once. And that brings us to our final section, your liver's future, and the synthesis of everything we've just talked about today. We're literally looking at a comprehensive battle plan against this silent epidemic right now. Science is leaving absolutely no stone unturned. We have dietary additions, harnessing the anti-inflammatory power of citrus polyphenols to gently nudge our lipid profiles in the right direction. We have lifestyle subtractions, strictly cutting carbohydrates to fundamentally reduce the liver's workload and burn away that dangerous fat. And we have pharmacological innovation, cleverly combining existing medications to literally reprogram the proteins inside our liver cells. Science is working tirelessly in the background to create the perfectly safe dual drug therapies of tomorrow. But, hey, your metabolic factory is running right now, today. Knowing that 1 in 3 people walk around with this silent condition, and knowing that your daily choices, from the simple fruit you eat to the specific carbs you cut, have a measurable, scientifically proven impact on your liver's machinery. What changes are you going to implement today to take control of your own metabolic health? Thank you so much for joining me for this explainer, and I absolutely can't wait to dive into our next fascinating topic with you.